those needs met. If that's something that you're interested in, please come see myself or Sue Elliott or Donna Patrick, and we would love to talk to you more about that. That's something that all of our legislators are needing to address. And again, this is happening with all levels of ages. We see it in children and adults. On the adult front, I will tell you one of the issues that we're seeing with adults is because our, I don't know if I'm supposed to go into this, but I'm going to, because our residential systems are kind of blocked because of the turnover in residential providers. You know, we're not able to keep stable residential providers. Therefore, we're having continual turnover in our residential systems. We're unable to get our adult sons and daughters any placement in residential settings. Our RHCs are blocked. Sorry, I'm trying to keep my opinions to myself. And because of lots of issues at that level. So individuals, you know, we heard a story last week of a 92-year-old that was still taking care of their adult child. We do not have the supports that we need in the community to take care of our loved ones, and we need that, right? And I'm not saying that residential doesn't do a good job or that the RHCs don't do a good job, because the workers that are there are doing the very best they can with what they have. But I don't know of a single person that if they can take care of their family and the community and have the services and supports they needed wouldn't choose that. So that's where we're at. That's what we're working on. We're trying to keep those kids those individuals, excuse me, out of hospitals, and trying to get community services so that all the loved ones can be taken care of close to where their individuals live. Thank you. Yes. I'm sorry, what
would help the residential providers have a stable workforce?
Oh, Sue wanted to know what would help the residential providers have a stable workforce. Well, our residential providers are paid substantially less than their individuals who are doing the exact same work but are working in the RHCs. So if we can increase the level of wages for the residential providers, we can stabilize that workforce, therefore the training will continue to develop their skill sets, right? It's not that we're not doing a ton of training in our communities with our residential providers, but last I heard there was like a 54% turnover rate. With a 54% turnover rate in residential, you're not going to be able to get those individuals stabilized. So looking at how can we build up supports in the community that are as stable as those supports that are being provided in just a couple places around the state.
Thanks much. Carla mentioned the report that was done by the DD Ombuds program, and Noah Seidel with the DD Ombuds program, and he's the ombuds for this particular area, is sitting back in the corner, so he would be happy, I'm sure, to answer any questions, as well as Tim McHugh, who's sitting right almost in front of Noah, both from the Ombuds program. One of the areas that I think is really important that helps support families are services like community engagement, community guide services, that we see an increasing number of people use. And we're going to have some training workshops, if anybody's interested in those services, come this spring. We're targeting Linwood, Kitsap County, Bremerton, Port Townsend, Pullman, and Walla Walla. So if you're in those areas or know people that might be interested in becoming a provider that helps somebody do something in their local community, or being a peer mentor that walks alongside somebody as they try to do something, pay attention, those flyers will be coming out. Next, we're going to do bills of interest and the budget items, and there's sheets in the back that are the bills of interest. As you know, yesterday, I got to work. I'm a morning person, so I got to work early, and I looked at my email, and there was a new bills of interest, so I copied it off, looked through the list. And then I think about 10 o'clock in the morning, there was another bills of interest that came out, and some additions to it. Or it puts a kind of like, face. And the other day on a phone call, there was some opinions that we didn't even have faces for, so I don't know if we're going to expand our faces or not. But Diane, if you want to come up here and begin bills of interest and then talk about the budget.
Thank you, Ed. Okay, well, I think we'll start with the budget first, and then we'll go into the bills. This budget sheet will have, it's a side-by-side, so by the end of the legislative session, the House will have come out with their proposal, the Senate will come out with their proposal, and then they'll have to mediate with the governor and figure out what the final budget is. But for right now, all we have is the governor's budget to go by. So you'll see a lot of smiley faces because we just went by what he put in there. Now, when the House comes out with theirs, they may have some of these things in theirs, which we would still keep as a smiley face, but they may add new things that the governor didn't put in his, and so they'll get a smiley face and he won't. So it'll look different as we go through each budget proposal and then the final budget. So at the top of the list, you'll see one of the issues that was just talked about by Darla, the community residential providers. And we know they have to have a rate increase. They can't keep people who only get minimum wage. Someone could go work at McDonald's for minimum wage and not have to do near as much work. So we've got to get the providers a rate increase. And the governor did put that in his budget, so that's our top priority there. But we also know that families need a break. It's the #1 ask from families is to get some respite, to have a break. And so he's put in there that we're going to expand overnight respite for both adults and children, but it's only 6 beds. And there's requests for a lot more than that, and we need it all around the state. High school students transitioning from high school to adults, and they need employment, they need lots of other services as they're changing out of that education system. So we want to make sure that they get onto the Basic Plus waiver and get some employment support so that they can be doing something other than going from school to the couch. We don't want to see that. So you can look through some of these others. A lot of them are just mainly increases for different providers. And then what our state thought was the number of people who would need a service has increased. So they need to make sure that the number of people utilizing the service are they're getting enough money for them. In the state-operated living alternatives, this is what the state put together to be a community home that is staffed by the state employees who come from the residential habilitation centers, RHCs. Those are our state institutions. So you will see an increase for staffing level at the RHCs, and this has to do with the Center for Medicare and Medicaid from the federal government. They come out and they do reviews on the RHCs to see how they're doing. And they haven't been able to pass those very well. And at Rainier, we're still waiting to hear if they're going to make their final survey or not. And it's not sounding like they will, even with the number of people they're adding for staff. So we want to make sure that there are enough homes in the community for these people to be able to go to when they leave the RHCs. So you will see some different funding numbers for placements. But in addition to having the staff for these places, one of the big problems we're looking at as well is housing. In order to create a SOLA, the state-operated living alternative, you have to have a house in the community to do it in. And there is not a lot of affordable, accessible housing available. It's a big issue for everyone, not just for us, but it is an issue for us as well. And you'll see some things for special education. Last year, the legislature just focused on education and getting it funded. This year, Chris Reichdahl, who is the superintendent of public instruction, he wants to have them address the special education system because it has been underfunded for years. So that kind of covers most of what is in our first budget proposal from the governor. Does anybody have any questions on that? Okay, let's move on to the bills. This is the fun part. So this is broken up into different sections. The budget bills right now are just the governor's budget proposal. Now that top section will change when we start seeing the House and Senate come out with theirs. Then under residential, we're watching a lot of the adult family home bills because some people with developmental disabilities live in the adult family homes. We have two bills that want to increase the number of beds that can be in an adult family home, up to 8 beds. We don't want adult family homes to become mini institutions. So we don't support adding more people into a community setting. The community residential rates that we talked about in the budget, there's been an issue for years between Snohomish and King County because providers who work in one, the cost of living is very different for where they live as opposed to where they work. And they've been trying for years to figure out some way to make that work for the workers. You know, one of the things that we see bills that to us just seem like common sense, and having a safe way out of an adult family home would just be, you know, logical to do. But we have to pass a bill to make sure that if you're in a wheelchair or don't have enough mobility to use stairs or an elevator in emergency, you need to be able to get out on the level that you're living on. So apparently that must have been an issue for somebody, and so we have two bills that address that. And there are some that are talking about background checks, being able to share those so you don't have to do 10 background checks for 10 different places that you're doing something in. The last one in the residential is doing a DD, developmental disability specialty contract for adult family homes who only serve people with developmental disabilities. That would give them better training and more information to serve the people that are living there. Under employment, we have a couple different issues. There's a bill that came forward this year, and this is a new one. They're called day training centers that they want to create. And we're not sure whether these would be, but most of them have no idea about how to work with students who have different needs. And so this would help give them some training to help them understand a little better so that when the student is trying to communicate something, even if it's through behavior, that they would have some understanding of how to help that student. There are also some bills looking at early learning. There's Senate Bill 5534 wants to start on so that when an adult with developmental disabilities gets a job, has employment, we don't want them losing their health care just because they're getting a job. Because sometimes it's hard and they may have that job for a while but not keep it, and then they've lost their health care. So this will work around the restrictions for the buy-in to the healthcare services for them. Telemedicine is another issue that we started looking at last year because especially for adults with disabilities, transportation is a big issue. It's hard to get places you want to go. And that goes for getting to a doctor. So if you could get on your computer and talk to your doctor on the computer for things and be able to visit with them that way, it would make it a lot easier than trying to go through the hassle of getting on a bus to go there, or several buses. So there was a bill passed last year that puts telemedicine into practice, and this year the bill is addressing making sure they don't charge you more for that. The rate for an office visit, they don't want the telemedicine visit to be any different. They don't want them charging you more money for it. So they're making sure that that is in there. One of the things that everybody I'd like to make aware of is Senator Patton called yesterday, and he has sponsored a bill, 5405, in the Senate. And this has to do with organ transplants, because apparently there are people with Down syndrome and other disabilities who've been denied a transplant just because they have Down syndrome. And that's not right. They think that that the person has a disability, well, they're not going to know what to do before and after care or anything like that. People have support systems to help them with that. And so Senator Patton is working to make it against the law that they can't just deny somebody a transplant because they have a developmental disability. That bill is going to get heard this coming Monday at 1:30. So he wants to make sure as many people are there to testify in support of this bill as possible. So if this issue might be important to you or somebody you know, try to come down on Monday so that you can testify. And if you can't, you can still go to the bill on the computer and you can provide your testimony via that way, by an email system. There are some bills. One of the things that we were talking about earlier is the hospital parking, where people are taken to the hospital because of severe behavior challenges, and then they get left there because there's no support to go back home with them. We are stuck working through the behavioral health system when our teens and adults start having behaviors. Now, behavioral health is what they are now calling mental health. So it's not the same thing as a developmental disability. But we have to use that system, and it doesn't work for our folks. So these bills would start looking at more of this, and they want to, in the first one, Senate Bill 5431 and House Bill 1394, these would provide some short-term residential intensive treatment services for people with developmental disabilities. The other ones, the two bills after that, 5432 and 1393, are more about mental health, and they just mention developmental disabilities, but don't really say that they provide much for that. So we're watching those and are hoping that we can get them to include language as the bill moves along, to actually put in some services for people with developmental disabilities. And then the last one in that section has to do with the unnecessary hospital use. When someone with a developmental disability is taken to the emergency room because they're having severe behavior challenges, and the provider or the parent does not want to take them back home because there's no support, nothing has changed, they might still be destroying things or hurting people, and it's because nobody at the hospital knows how to figure out what this person is trying to communicate. Well, when nobody takes them home, that means they're left at the hospital, and the hospital has to put them in a room. There's no medical need. That person is in that hospital bed without a medical need. So people who come to the hospital with a medical need can't get a bed because these people are taking up those beds, and they don't want to be there. So Senator Braun has put forward Senate Bill 5483, and that will track the number of people who are being left in the hospital. So we actually have numbers, because up to this point, the Developmental Disabilities Administration hasn't even been tracking this issue. And it would also say that they have to use some of the crisis care that's in the community or the RHCs. And if these clients of DDA are left in a hospital, DDA will have to pay the same rate that they have to pay for an RHC placement. And that's very expensive. It's about $800 a day. So we're trying to get this addressed through different ways, and it's not a short-term solution. None of them are. We're going to have to work on this for a while to create a system that will actually really help. The next section goes into protections and civil rights disabilities. Wrongful death, we've been working on that for like 20 years and have not been able to pass a bill. Last year, it almost went through, but it was a short session, and we ran out of time on the House floor, and it just didn't have time to get passed. So we have both the House and the Senate. This 1135 in the House and 5163 in the Senate. And these bills got started early. They've already had hearings, and one of them is scheduled to be exec or get it out of committee and move it on Friday. Guardianship, you'll see that there's a number of them about guardianship and supported decision-making as an alternative to guardianship, because not everybody needs to have a full guardianship. A lot of self-advocates are able to make their own decisions, they just need some guidance. And that's what supported decision-making is. So you'll see a lot of those that have to do with that and the Office of Public Guardianship, which is our public place that helps people with developmental disabilities that don't have somebody who can be a guardian for them. There's another one that the DD Ombuds has put forward this year, and this has to do with client rights at the Developmental Disabilities Administration. If you're a client, they should be providing you in writing what your rights are. And this doesn't really exist at this time, so this is something that the DD Ombuds has gone through and written a section that would be what your rights are, and to make sure that they want to get DDA to put this in writing for people when they have their assessment done, and also when they're first determined eligible for services through DDA. We have some other bills that didn't really fit a category, so we're just sticking them in other. One of them has to do with plastic straws. And this was actually, had a hearing this last week, and there were a number of people that turned out. Now this was put forward by a high school class of students, and they were concerned about the environment, and so they thought, well, let's get rid of plastic straws. That's not enough room in that striped area to get your car to put down its ramp and have enough room to get off of the ramp. So they're looking to try and make those van accessible ones, the few that there are, just be for vans that need them. Personal caregiver access. Many times, you know, you want to go out into the community, and maybe you want to go to a ball game or somewhere else, but you need to have your caregiver with you because you need help with whatever it is they do. But you don't want to have to pay for you to go in and for your caregiver to go in when maybe the caregiver doesn't even like a ball game, but they're going because they're working for you to help take care of you. Well, that caregiver shouldn't have to pay for entrance when they're only there because you need their support. And then the last one is in the what we call intermediate care facilities, and those are our state institutions again. One of the big issues has been that CMS, the Center for Medicare and Medicaid, says those are only supposed to be intermediate places. They were not designed to be places where people live their whole life. They're supposed to go there. They're supposed to get help in what they call continuous active aggressive treatment to give them some skills that will help them so they can move back to the community. And so this bill, the last one, 5536 in the Senate, would say, okay, we want to have an assessment done every 90 days to see if that person has improved their skills enough to move back out into the community, so they aren't just left there all their lives. So that's a wrap up of the bills we have now. There's still more coming. I know I've been working with Senator Conway. We found out from DDA that although all the community providers got a 2% raise from the legislature last year, respite providers in the community did not. And so he's going to try and get that 2% raise for them as well. And then community engagement and community guide services. You heard Ed talking about those earlier. There's not enough community guides and community engagement providers. And part of that is because the rate that they get for providing those services, they barely break even. The insurance cost is really high, the liability insurance. And so that makes it so we don't have enough of those providers anyway. So he's working on a bill to address that. So we have cutoff coming up where bills will have to have had their first hearing in their committee. Or if they don't make it past the date, then that bill dies for this year. So there still will be more bills being dropped probably this next week a bit, but then they'll stop after that because then they'll start hitting all the cutoff dates. So this 4 pages that you have is a vast majority of what's going to be out there, but we post them on our website every week, so look on the ARCS.
I guess for something particularly in Snohomish County, but you had mentioned it's in the governor's budget, so if you talk to our legislators, is that what we refer to the governor's budget?
Yes, it's the top item on the governor's budget. It looks like this.
Okay.
That would be for the residential providers. And was there another question, or is that the same one? Okay. Any other questions? Okay, is Amy here? I didn't see her come in. Well, Angela, can you bring me one of those bags? I guess I'm doing that part too. So, every week, we distribute information to legislators about the topic for this week, which is our incredible families and the things that they need. So we have packets where people, and we would love to have your help with distributing them. We have them made up really easily. They go by floor of a building. So you could take like the third one of the buildings, gives you the name of all the legislators and what their room is. Whenever you're up here, that makes a huge difference. Even if it's just to chat, and you may find out that that legislature, it's the connection with the legislators and their LAs. So I encourage you to take a packet. They're all up here, and you can run around and just take them and drop them off after we're all done here. So we also have back on the table the evaluation form. It's on a green piece of paper.